to chair this session on cultural psychiatry, which is my topic of work and research. And I've given about 15 minutes just for your information. The speakers, there's a small countdown if you haven't given other presentations where you're standing, and it will just count down so you can see how much time you have left. It's not that you get a bit confused, what is this? It's just a timer. But I would like to welcome our first speaker, Dr. Sami Juanes, who is talking about Quranic healing and mental illness in Tunisia. Please.
Thank you. Hello. I am Sami Juanes from Tunisia, and I'm delighted and honored to give this presentation today about Ruqya, or Quranic healing, and mental illness in Tunisia. So, first of all, I have no conflicts of interest. So, apart from standard medical mental health care, patients with mental disorders commonly resort to complementary and alternative medicine. So, although varying in nature from culture to culture, this is a common practice. And in the Islamic world in general, and in Tunisia in particular, Quranic healing, or Ruqya, is widely believed to cure many psychiatric disorders. So here is a map of the Islamic world, and so with 57 countries and 1.6 billion people. And here's the map of Tunisia. So as you can see here, Tunisia is a small country in North Africa that belongs to the Islamic world. But first of all, what's Ruqya? So Ruqya, also called Quranic healing, refers to treating various diseases by reciting verses from Quran. So Quran, as you can see on the picture here, is the holy book of Muslim people. So we call Ruqya a traditional Quranic healer. So what's the definition of Ruqya? So we asked Tunisian Iraqi, and this is the answer we got. So first of all, Ruqya is a treatment and relief of people whose lives are stuck and who have been suffering for years. Secondly, it's a protection for Muslims against shirk, means against misbelief, and it's a way of strengthening their faith. So we have both a medical role, treating disorders, and a religious role of protection against misbelief. So, what are the roots of Ruqya? Well, certainly there are some religious roots, but it appears that religious roots are not that obvious because Islamic teachings in general incite patients to consult a physician rather than a Ruqya. So it's more of an inherited traditional custom made holy and attractive by the means of religious covenant. That's probably the most relevant choice. So, what is Ruqya for? Well, according to Ruqya, there are three types of illnesses. So there are physical illnesses, which give physical symptoms and signs. There are mental illnesses, which give psychiatric symptoms. And there are also spiritual illnesses, which give physical and/or psychiatric symptoms. So, according to Ruqyas, that's to say Quranic healers, so physical illnesses warrant medical care, but they can also be effective. So mental illnesses warrant psychiatric care, but Ruqya can also be helpful. And then for spiritual illness, definitely needs Ruqya for treatment, and although medical treatment can provide some symptomatic relief, the only cure for such illnesses is Ruqya, according, of course, to traditional healers. So most Ruqyas believe they are able to distinguish genuine medical disorders that require pharmacological treatment from spiritual illnesses, from spiritual diseases that require Ruqya. But how to diagnose a spiritual disease according to Ruqyas? Well, Ruqyas believe that we should diagnose a patient with a spiritual disease when we have an unusual clinical presentation, when the disease can't be diagnosed by medical instruments, and then when the disease is refractory to medical treatment. So these are the criteria of a spiritual disease according to traditional healers in our country, in Tunisia. So what causes a spiritual disease among the popular belief and according to Ruqyas? So a spiritual disease can be due to witchcraft, sihr. It can be due to evil eye, to ayn, or to possession by jinns. So Ruqya can cure all these kinds of spiritual diseases, either by dispelling witchcraft, by dissipating evil eye, or by evicting jinns. So, of course, that's according to Ruqyas. So, by whom Ruqya is performed? Well, usually Ruqya is performed by people who are believed to be pious, but sometimes it might be performed by the patient himself or by a member of his family. So how Ruqya is performed? Well, there are many methods to perform Ruqya. The common point between all these methods, in fact, is that it involves reciting verses from the Holy Book, from Quran. So one can simply recite verses, or he can recite verses on water, then drink or take a shower with that water. One can recite verses on oil, then use that oil as an ointment. And one can recite verses also as a method of exorcism. And here I will be showing you a short video clip that shows Ruqya as a method of exorcism.
من ولي الله الذي نزل الكتاب وهو يتولى الصالحين أينما تكونوا يأتي بكم الله جميعا إن الله على كل شيء قدير. أنت هنا ماذا تفعلين معه؟ لا تفعلين شيء، فقط تسكنين في جسمه. محمد رسول الله، محمد رسول الله. ماذا بك في هذا الجسد؟ حرقوني يحرقوني. خلاص انطلقوا، السلام عليكم.
So that was a traditional healer, a Ruqya, Tunisian Ruqya, with the patient, and this was an exorcism using Ruqya. So, is Ruqya effective? Well, there are no randomized controlled studies, of course, but from the empirical point of view, from the clinical practice, we can expect a placebo effect, especially in patients who are suggestive, who have, for instance, a histrionic personality disorder, and some patients with conversion disorder often consult therapies and are often improved by Ruqya, probably thanks to that placebo effect. But the nocebo effect cannot be ruled out, because these same patients who are suggestive might see some symptoms who are induced by Ruqya, and they might believe they have a jinn or they are possessed by jinn. A jinn is a spiritual creature from the unseen world who is thought to possess human beings. Well, in Tunisia, Ruqya seems to be more commonly used to treat mental than physical conditions, and this is probably due to the nature of symptoms. The psychiatric symptoms are often more mystifying. This is due to the lack of physical, biological, or imaging findings, and patients tend to require and to request such findings to see objectively that they have some kind of diagnosed disease, and then also because of the stigma associated with psychiatric disorders. After all, it might be better to have a spiritual disease than to have a psychiatric disease. So, therefore, religious and spiritual explanations of mental disorders are quite common in Tunisia, both among patients and among their families. Among patients, in around 3/4 of patients with schizophrenia, and among their families also, because around 2/3 of mothers believe their child's first psychotic episode was due to a possession by jinn. Treatment by Ruqya is commonly sought by mental patients. Around half of them seek treatment by Ruqya in Tunisia, And this is common regardless of age, profession, and educational level. So the treatment can be sought either prior to seeking psychiatric care. This is the case of 70% of patients, but sometimes also along with psychiatric care. So often prior to seeking psychiatric care, so the patients, instead of seeking psychiatric care, tend to consult trackies first in order to rule out a spiritual disease. They often consult a psychiatrist only when behavioral disturbances become unbearable or when treatment by Ruqya fails. This leads to delayed diagnosis, to delayed treatment, and thus probably poorer prognosis for these patients. So, but Ruqya can also be sought along with psychiatric care. And then Raqis give the illness a religious, spiritual explanation, which is often more convincing for some patients than the difficult biological, psychosocial explanations and models we are trying to explain to them. So, after all, for these patients, given that the religious explanation, there's probably no rationale behind prescribing medication. Why should I take a medication when I have a spiritual disease rather than a psychiatric disease? And even some Raqis recommend their patients to quit taking psychotropic drugs. This might lead to poorer compliance and thus to poorer prognosis. However, one study performed in 2008 showed the opposite, since this study showed that therapeutic compliance to the modern psychiatry was not influenced by the use of traditional therapy. However, we also have newer studies, so our team is carrying out newer studies, and the first results show the opposite and show that patients who consult therapies often have a significantly poorer compliance, and that might lead us to think that they should also have a poorer prognosis. So to conclude, you can say that according to the popular belief in Tunisia, many psychiatric symptoms might be attributed to the effects of witchcraft, evil eye, or possession by jinns. Ruqya is commonly used to counter sihr, that means witchcraft, ayn, evil eye, or as a means of exorcism. Such beliefs might delay appropriate psychiatric care, hinder therapeutic compliance, thus leading to poorer prognosis. Hence, communicating with Raqis and spreading knowledge about psychiatric disorders might prove helpful. And thank you for your attention.
Thank you very much, Dr. Juanes, and you have left some time for discussions for this very interesting presentation on the Quranic healing. I don't know if any of you have comments. If not, I have a comment myself. Do you collaborate with these Raqis in the psychiatric hospitals, or how is your relation with them?
In general, we are not collaborating with them, so patients tend to consult them, and this is quite common, but sometimes we're surprised that some Raqis in fact address patients to the hospital. So some of them address patients, but in general there's absolutely no collaboration, no real collaboration in the field.
Because I was thinking that if you had some educational influence, they may be able to distinguish what can they do and whom should they refer to psychiatric care.
In general, what's happening commonly is that they try their methods, and when their methods don't work, so either the patient himself consults a psychiatrist, or sometimes they even address him.
Okay. Yes, please. A question? You have a question?
What is the attitude of the government against such healers? Friendly or
they are tolerating? They tolerate such practices. So, if we apply the Tunisian law, normally such practices are prohibited by law, but this law is not enforced, and in general they are So you can see Iraqis everywhere in Tunisia, and they are tolerated.
My name is Victor Koratowski. I've worked a lot with Muslim patients. Also, I've been to Morocco.
Maybe speak up a little.
I've been also to Morocco, and the situation there, I think, might be comparable to Tunisia, in the sense that modern psychiatry has a very high threshold. Yeah? So it's for normal people, it's very bad to go there. My experience also from the Netherlands is that, for instance, if you say that medicine might help making you stronger against those influences, then you have a chance that both methods, that you can work along. But in general, I mean, it's much more easy for people to build up a relationship with someone with Iraqi than with a psychiatrist in the country.
Certainly.
Yeah.
Well, in common practice, what we are, most physicians are not preventing patients from consulting. They are not recommending them against consulting Iraqis. We are tolerating that, and we are even trying to let them think that maybe these are two ways to understand the same disease, and maybe so we ask them not to stop their medication. We try to convince them that medication or that these drugs we prescribe will be helpful to them, but we are not trying to counter or to convince them that such religious or spiritual explanations are false. So we are accepting these religious beliefs, and sometimes even we are trying to use them as a means to convince patients not to quit their medication. This what we are trying to do in daily practice.
I'm afraid, could you be very, very short, because Dr. Swanes has to go to another presentation.
Okay, this is a very interesting presentation. I'm from Ethiopia, and I heard that you are presenting about Ethiopia, because we have the same problems. And they tell our patients to stop their medications if they are going to take the traditional treatment, which negatively affects the adherence of our patients. But I would like to know if, in your opinion, or if this traditional treatment works to a certain extent for specific disorders, in your opinion.
In our daily practice, we see that histrionic patients and patients with convulsion disorder, somatoform disorders in general, tend to get better with such a treatment, especially when the underlying personality is suggestive. So such patients do get better with Ruqya. Of course, there are no studies, but that's the empirical. So empirically, they get better. But also we can see the opposite effect, because some patients get worse with Ruqya, not only because of that delayed diagnosis, but sometimes Iraqis might induce, by suggestion probably, they might induce symptoms in some patients. And sometimes we have a patient who has, for instance, convulsion disorder, who goes to see Iraqi, and then he has a firm belief that he's possessed by a jinn. And then sometimes he won't improve, and it's quite difficult sometimes to convince him of the opposite idea, especially since such ideas are deeply rooted in our society and deeply rooted in the common belief, the popular belief.
So thank you very much, Dr. Swanes, and we have to move on to the next speaker.